I thought we said we're good. Was I misunderstood? You looking at me so cold. After all that we've been through, how could you pretend someone let you down?
Okay, good evening. This is Frederick Colina and Bachelor of Science in Respiratory Therapy, fourth year college, and hopefully graduating in the future, near future. And this is my continuation on our part with Tabuhara or Teresa Tabuhara, whom she explained the first part of the pulmonary rehabilitation of the part that she introduced and the basics and the importance of the pulmonary rehabilitation. And for my part, pulmonary rehabilitation, the overview and the importance in the continuation. So here it is. So pulmonary rehabilitation, it is a supervised program that includes exercise, training, health education, and breathing techniques for people who have certain lung conditions or lung problems due to other conditions. So your doctor may recommend pulmonary rehabilitation to help you breathe easier and improve your quality of life. For certain lung conditions such as chronic obstructive pulmonary disease, COPD, asthma, pulmonary hypertension, and cystic fibrosis. It can also improve the daily life of people who have scoliosis or other health problems that limit lung function. So, your doctor may also recommend the pulmonary rehabilitation before and after surgery for a lung transplant or lung cancer. So, pulmonary rehabilitation can help you gain strength, reduce symptoms of anxiety or depression, and make it easier to manage routine activities, work and outings, or social activities that you and the others enjoy. So you may have pulmonary rehabilitation in the hospital or a clinic, or you may learn physical therapy or breathing exercises to do it at home. So you may also use activity monitors or smartphone-based lessons or monitoring. Your team of healthcare providers, or also known as the respiratory therapists, the licensed respiratory therapists, will design a personal pulmonary rehabilitation plan based on your need. So, the pulmonary rehabilitation has a few risks. What are they? Rarely, physical activity during the program can cause problems, such as injuries to your muscles and bones. If serious problems occur during the supervised sessions, your pulmonary rehabilitation team will stop the physical activity right away and give you the appropriate treatment and contact your doctor. And so for the top 10 benefits of pulmonary rehabilitation, most COPD or the chronic obstructive pulmonary disease guidelines recommend completion of a pulmonary rehabilitation program for anyone with mild to moderate COPD or anyone who experiences a restriction in activities due to difficulty of breathing or other COPD symptoms. While it won't improve lung function or cure your COPD, it may improve the quality and length of your life. So with that said, here are the 10 benefits of pulmonary rehabilitation or 10 reasons why completion of such a program may benefit you. Number 1, you'll become educated about your disease. So you'll learn the importance of quitting smoking and receive some tips on how to quit. You'll learn the basics of your disease and how to manage yourself on a daily basis. You'll learn how to manage flare-ups and when to call for help. So number 2, you'll learn about COPD medicine. You'll also learn about the medicines used to prevent and treat COPD symptoms. You will learn about inhalers and nebulizers and maybe even ask to demonstrate that you are using them correctly. And for the third one, you'll learn the importance of staying active. You'll learn that daily exercise is important even if it entails a simple walk through the house. You'll learn what exercises are best for you and how to use the equipment safely. Exercise helps boost your immune system and reduces your fatigue so you can stay active. Number 4, it improves your sense of well-being. Why? Because COPD has been linked with depression. Exercise mainly causes your brain to release chemicals called endorphins. They are often referred to as exogenous morphine because they act similarly to morphine in reducing the perception of pain and improving your sense of well-being. Exercise may actually be the best way to prevent and treat depression so you continue to feel good about yourself and your life. And number 5, it reduces the feeling of dyspnea or the air hunger with movement. Part of exercise training may entail during and riding a stationary bike. This helps to strengthen your heart so it becomes more efficient at pumping oxygen and other nutrients throughout your body. This helps to make you more dyspnea tolerant or less likely to feel winded when you exert yourself. So you should be able to move around and stay active for long periods of time. Number 6, helps you keep up your strength. Why? When you don't move around for fear of getting winded, this can cause muscle wasting that makes it even harder to move around. A key part of pulmonary rehab is using light weights to provide resistance training to the muscles of your arms and legs to help you maintain the muscle strength. You need to stay physically active. And number 7, you learn healthy eating habits. Not eating a healthy diet may also lead to muscle wasting. Since some foods and large meals may cause gas and bloating that makes breathing difficult, some resort to poor eating habits, and the nutrition counseling teaches you what foods you can eat to assure you are getting the nutrients you need to keep up your strength and endurance. It also teaches healthy eating habits such as eating light meals more frequently so you can breathe easy and stay active. Number 8 is the psychosocial support. Along with the wonderful experts helping you, you'll meet other people living with it just like you. These encounters sometimes lead to friends who may offer you emotional, spiritual, and motivational support you need as you make the necessary lifestyle changes to adjust to living with a chronic lung disease. Number 9, it helps you out of the hospital. Helps keep you out of the hospital. Why? Studies show that pulmonary rehabilitation reduces hospital admissions and readmissions. One theory suggests that ITBLO or ITBLO slows the progressions of the disease, making flare-ups less frequent and less severe. And lastly, number 10, it may help you live longer. Why? Quitting smoking is the single best thing you can do to slow the progression of your disease. Wearing oxygen as prescribed, if prescribed, is also proven to prolong life. While studies are inconclusive, some seem to suggest that completion of a pulmonary rehabilitation program may also slow progression of your disease so you can breathe easier, live better, and live longer with COPD. Studies continue to pour in that indicate even greater benefits. So, studies show benefits even for those with mild COPD or with no exercise limitation. Studies shows that the longer the program, the benefits. However, studies also show that these benefits are not long-lasting. For this reason, most doctors recommend to those who have completed a program or who cannot participate, exercise at least 20 minutes every day, even if it entails a simple walk. So, another thing for the